All right. Can everyone hear me okay?
Yep.
All right, perfect. Okay, so welcome. Good afternoon, everyone, and welcome to our MEDSIS Data Users Call special session where our Outbreak team will talk about the new Outbreak module changes and some helpful tips and guidance. The Outbreak team will run through a demo, and there will be a Q&A section after the demo. Just want to remind everyone again that there are 3 reference documents within the calendar invite, and it's also available in MEDSIS resources. And we suggest you have it on hand during the demo. Any questions before I hand it over to the Outbreak team? All right, I think we could start. I'll pass it over to the Outbreak team.
Hey, thanks, Amy. I'll go ahead and share my screen. Let's see. And it should be the Outbreak, the MEDSIS training environment. That look good?
Yes, Guillermo.
Okay, perfect. Thank you. Hey, everyone, this is Guillermo. I'm part of the COVID Outbreak team, along with Irene Roberto, Gabi Hecht, and Mary Lee Butterfield. Thanks for joining. Just a heads up in case you came a little bit late, this meeting is being recorded, so you can look back on it and also provide it to others who are not on this call as a resource. And so, as Amy mentioned, we're going to save the Q&A session for the end, but I think feel free to type them into the chat and someone else from the Outbreak team will either respond to them in the chat or just collect them to address at the end. Also, we recognize Outbreak module is not the easiest to navigate, so don't worry if you didn't quite catch something during the presentation, because we'll be providing the presentation notes as a resource as well. And of course, our Outbreak team will be available to support you long after this presentation is over. So yeah, we're gonna run through a demonstration within Outbreak module, and which you probably hear me call OBM for short, different times using fake data that I created in the MEDSIS training environment, just a little bit of data from one of my favorite TV shows, Stranger Things. So during the demo, as Amy mentioned, we're gonna cover a few topics, namely how to create an Outbreak entry in the Outbreak module, required elements for COVID-19 outbreak reports, how to summarize and close an Outbreak entry in OBM, and accessing and using Outbreak data. So first, I just want to give a brief summary of when an Outbreak entry should be created, which is to document confirmed and suspected outbreaks. Generally speaking, an Outbreak entry should be used to document one or more cases in COVID-19 in congregate settings where unrelated individuals live and sleep, such as long-term care facilities, assisted living facilities, group homes, prisons, etc. For other settings where individuals don't live and sleep, but do work or gather in close proximity, such as workplaces, religious facilities, schools, etc., we want to record an Outbreak entry in OBM when there is documented or suspected spread within that setting. So one case generally would not be enough for these settings unless, for example, a case said they were at a work party a week ago and colleagues were coughing and they know of other people who are sick now, then you might want to open one up for that setting, even if you only have one case so far. We do have some more guidance about different situations that require an Outbreak entry in our COVID-19 congregate setting PDF, which is attached in the invite as well as in our MEDSIS resources page here. And just want to show the pathway. We have it many times in our guidance documents, and I'll probably refer to this one a lot, the COVID-19 outbreak definitions and OBM guidance. I usually just call it our OBM guidance for short. but it's got outbreak definitions and is pretty key as well. And I'll just take this opportunity to say that this presentation and the presentation notes, these are all really complementary to one another. So there's not really one resource fits all. But we hope they're all very helpful. And again, we're here to help with the rest. Okay. After investigations into the outbreaks are completed, investigators will need to document in Outbreak module if the outbreak criteria were met for a confirmed outbreak. And we'll get into that later, but again, we do have that outbreak definitions in our outbreak guidance document that I showed and is attached. So our first topic is how to create an outbreak entry in Outbreak module. An outbreak module being in this OB management tab right here. So let's go ahead and click in that. Before creating an outbreak, a new outbreak entry, we want to search to determine if an outbreak entry has already been created for that setting. And OBM has several ways to search, including outbreak ID, outbreak name, a few other fields as well that you can narrow down by, you can search by. And if an existing outbreak entry is not found, we'll go ahead and click new outbreak, create new outbreak up here. So let's go ahead and search by name. I'm going to open up one for Hawkins Middle School. So let's search for Hawkins or Hawk. And we see one here, but it's been ruled out in the name, and you can see the outbreak status is ruled out. So it was determined to not be an outbreak after it was investigated. So one other note, a lot of other places in MEDSIS, you can use an asterisk as a wildcard, but we don't want to do that here in Outbreak module. It won't show up. So make sure you don't use the asterisk. And since we do want to create this outbreak, let's go ahead and click create new outbreak. There are 5 fields that are required to actually create an outbreak entry. They're all highlighted in red here, and we'll go through them. Starting with outbreak name, you can really choose any name you want here. However, we do recommend you consider using an outbreak name that can easily be interpreted by others, such as when they're linking other cases to the outbreak entry. And I'll show that how you can do that later. For most COVID outbreaks, investigators use the name of the location or the facility as the outbreak name. For example, Desert Care Assisted Living or Kids R Us Learning Center. Or for us, we're going to do Hawkins Middle School. The next fields, the date reported to the local health department. Please enter the dates that you at the local health agency received the first report of this outbreak. If the report was first received by us at ADHS, and then we let you know, please indicate the dates that we notified the local health agency of cases in your jurisdiction. So let's go ahead and say we found out it was reported to, and I'm in the epi role at Coconino County. So acting as a Coconino epi here. Next, we've got the morbidity, pretty straightforward, but we do want to issue a word of caution to try to ensure you select the correct morbidity, because once you create the outbreak entry, this field cannot be changed, whereas others can. So for COVID-19, we want novel coronavirus. So go ahead and click that here. Now, outbreaks of respiratory illness that have not yet had a confirmatory testing can be entered with a morbidity of unknown respiratory illness. This morbidity can be later changed to novel coronavirus or another respiratory pathogen once confirmed. However, an outbreak entered as novel coronavirus cannot be changed to another morbidity. So if the morbidity is entered incorrectly, say you accidentally clicked norovirus or something around there, you meant to select novel coronavirus, it's not the end of the world. You just have to update the outbreak status which is here. We haven't created the outbreak yet, but once we do, this field will be able to be edited. So you just have to update this field to ruled out and re-enter the outbreak with a correct morbidity. Please also note that outbreak entries cannot be deleted or merged. So we've got the correct morbidity here. Moving on to the type of setting. For outbreaks occurring in a licensed medical, residential, or childcare facility, investigators should ensure that the type of setting matches the licensing type at AZ CareCheck. This is the database of the medical, residential, childcare, and other facilities that are licensed by ADHS. So just type in azcarecheck.com. This is the database. It's got kind of a types of facilities that require licensing, a license by ADHS. And you can search, let's say, we're searching for Anna's Haven Adult Home Care. You can see this is an assisted living home. So, we could go ahead and select assisted living, for example. But ours is a middle school. So let's scroll down here and select that. If the facility is not licensed but is required to have a license, please indicate such in the outbreak entry, then notify our ADHS Bureau of Licensing, or you can notify us at the ADHS COVID outbreak team. If the type of setting doesn't fit one of the OBM drop-down options, you can select other, and then you can specify in this location description field right below, or also, and you'll see later, once we create the entry, there will be a summary 2 page, which has a field, quote unquote, if other setting of exposure is specified, where you can enter free text into that field as well, or that field. And for more outbreak, for more guidance on the type of setting, you can see our congregate setting guidance in MEDSIS resources as well. And lastly, we just want to enter the county of the setting location. So we're going to say this is in Coconino. And you can enter other fields, as I mentioned, but those are the 5 required to create an outbreak entry. So let's go ahead and click Save Outbreak Data. And so now we have officially created the outbreak entry with the morbidity, the outbreak name that we entered here, and this will also generate an outbreak ID. This field can also not be changed, like morbidity, after it's created. And just to let you know what the numbers all mean, 21 for 2021, the second string of numbers is just the sequential order that the outbreak was created in. This middle one here is just the code for the type of setting. So we selected middle school, the morbidity, novel coronavirus, and lastly, we created this outbreak entry on February 4th, so 0204. Okay. Also, as I mentioned, after we create the outbreak entry, we'll see these several pages appear here on the right. And please keep in mind that when updating information on each page, you must click Save on the page before moving to another page, or the data will be lost. There's no warning or reminder to save before moving to another page, so just a good best practice to save pretty regularly, and definitely save before you click on any other page. So let's go ahead and cover each page individually. We're still on the main page. It's the same page that we used to create the outbreak. And we have 6 required elements on this main page. Required elements meaning fields that must be filled out to close an outbreak. Some have already been filled when we created the outbreak already, and some have not. So let's go through them. And this required elements is also an attachment in the invite and in the MEDSIS resources folder. So date reported to local health, we covered that. The investigation start date, enter the date that the investigation activities first started, activities such as following up with event organizers, contacting cases, reviewing exposure data from existing MEDSIS cases, etc. So let's just say we started on New Year. And then scrolling down to the next one, outbreak identified by, there's a handful of options here. So select the method by which the outbreak was reported to the local health department or ADHS, or the method by which the outbreak was identified by the local health department or ADHS. A few of the more commonly used options for COVID outbreaks include the ICP, sorry, got a notification. The ICP/clinical report. Select this option if the outbreak was reported to the local health department or ADHS by an infection control practitioner or clinician. We have school report. Select this option if the outbreak was reported by a school or child care facility. Surveillance by ADHS is if the outbreak was identified through surveillance activities at ADHS, like routine case investigation by ADHS investigators, etc. And surveillance by LHD, same idea, but for the local health department. So let's say the middle school outbreak was a school report by an administrator. The type of setting, we covered that earlier. If, again, you needed any help, we're always available to help you determine the type of setting. I should also say that you can change this field, but even after you create the outbreak entry, but again, the ID will always remain the same. So this MSCH, this middle school code, will always stay the same no matter what. So if you're querying your data for a type of setting, you'll want to use this variable instead of searching by the outbreak ID. Okay. For location, we want to indicate the name of the setting. For example, enter the name of the school, which we'll do, long-term care facility, correctional facility, etc. Please don't enter the address in this field. The fields are below for the address. And for outbreaks occurring in those residential, those licensed facilities that we mentioned that should be licensed in AZ Care Check, please enter the name of those facilities in the location. So what I usually do is I just copy and paste the name right into the location. I copy and paste the address as well if it's a licensed facility. Next, for Street 1 and the city town, these are both required elements as well. So again, enter the address for the setting location. Use AZ Care Check if you need to, if it's helpful. And that's pretty much it. So let's say it's on Star Court and it's in Hawkins. I personally always enter the zip code as well. And I think we're good to go. So let's go ahead and save this page. Now that we've covered the required elements on this main page, I do also want to mention one additional area here. We frequently have situations in which cases in the outbreak are in a jurisdiction outside of the outbreak jurisdiction. For example, a resident of one county might be a staff member at a facility experiencing an outbreak in a different county. In this situation, the outbreak entry must be shared, which you can do here, with that other jurisdiction in order for the case to be linked to that outbreak. So let's say we find out that a staff member, part of the outbreak, is actually a Yavapai County resident. So we want to go ahead and share this outbreak with Yavapai and save. Let's also look at the outbreak status field now that I've mentioned a few times. But when an outbreak entry is created, this outbreak status defaults to open, right? Haven't touched it yet. And if feasible, we would like users to update this outbreak status in real time throughout the investigation. And I'll go through what the different options mean. But an outbreak status of open indicates that the investigator is still investigating. At this time, we're recommending that jurisdictions review open outbreak entries to identify outbreaks that have been resolved, then update the outbreak status and complete the outbreak data as described in the rest of this presentation. Change the outbreak status to investigation complete when the outbreak has resolved. Then complete the required elements, again, as described in the presentation. And you must click Save Outbreak Data for the outbreak status change to take effect. Once the required elements are complete and you have finished editing the outbreak entry, update the outbreaks, the status to closed, and save again. This will be considered submitted to ADHS, at which point we will review the data for completeness. All suspect outbreaks should be documented in outbreak module, but an outbreak status of closed should be used only for outbreaks that meet the requirements for a confirmed outbreak based on the outbreak definitions, which we have in our outbreak guidance that I brought up before. Lastly, update the outbreak status to ruled out if the investigator determines that it was not actually an outbreak or did not meet the outbreak definition criteria for the setting, or there wasn't enough information available to determine that it was an outbreak. All suspect outbreaks should be recorded in outbreak module, but the outbreak will then be considered confirmed only if meeting the criteria as outlined in the outbreak definition. Because outbreak entries cannot be deleted or merged, update the outbreak status to ruled out if the outbreak entry is a duplicate or if the outbreak entry was entered with the wrong morbidity, as I mentioned. Please indicate in the additional notes at the bottom of page 2, which is here, why the outbreak status was updated to ruled out. That'll just help us know. And in order to update to ruled out, you can't actually do it from an opened status. So you'll get this notification. You'll actually have to update it first to investigation complete. I'll save that, and you'll see the investigation complete date will populate, and then you can save it as ruled out. But we're not done with ours, so let's go back to we'll just say investigation complete or open. Doesn't really matter at this point. And the remaining options in the outbreak status will be used by ADHS. So let's go ahead and move on to the persons page. There aren't actually any required elements on this page. However, here is where you will see cases that have been linked to the outbreak entry at the line list at the bottom. We just created the outbreak entry. We haven't linked any cases yet, so we don't have a line list. But we're going to do that. The simplest way to link a case to an outbreak entry is from within the case in MEDSIS, and let me show you how to do that real quick. I'm going to leave outbreak module and go to a case. So Mike Wheeler, we're going to link him to the outbreak. You can scroll down or just click on the outbreak section here. And we want ES, OBM, and Hawkins Middle School. So go ahead and save that. If you don't see the outbreak name listed here, it might be because it wasn't shared with you. So you might need to reach out to another jurisdiction to have them share the outbreak entry with you. And you can go back to the outbreak entry by clicking Go to Outbreak Line List here. And it takes you back to the persons page. You can also link a case to an outbreak entry from within the persons page here. And you do that. So Mike's data is all populated. So let's enter a new search. And you have to have the first and last name exact. So let's search for Jim Hopper. Okay, I got it exactly. First and last name. So let's link him. Okay. So he's linked. Not showing up yet. So let's go ahead and save person data. And now he's in our line list. And you can actually click on these sort of filter them by column. I never link people this way. I always go into the MEDSIS case. I find that's just easier, more certain, more intuitive as well. So, yeah, this method can be a bit more challenging, but you can always, again, reach out to us for support. We're also available to support local health jurisdictions in identifying cases that should be linked to closed outbreaks, but are not yet linked based on information in the at-risk fields or DSO. Another option in Outbreak module is to add additional outbreak-related information for cases that are linked to the outbreak in what is called the short form. And you can access the short form from the MEDSIS case. And so let's go ahead and click in the MEDSIS case, go back to the outbreak, and let's enter the short form for Mike. I'd actually already had him. It would be blank, but let's say Mike is a student. Our Outbreak team often uses this facility affiliation field for staff, for residents, the long-term care facilities, for example. We also use residents for inmates, but Mike's a student. If he was a teacher, could put staff. And for inmates, we also use we put the units here. So definitely feel free to use this. However, we would definitely like this facility affiliation field filled if possible. That would be awesome. So then we'll go ahead and save the short form here. And you can go back to Mike's case, or you can go back to Outbreak module. So let's go back to Outbreak module, clicking this button here. Okay, I think that's it for the persons page. So we've already saved. Let's go on to the summary page. This page has a functionality to auto-populate certain data, but in order for that to happen, several additional steps need to be taken. So we recommend using the CNE info manual entry option. You can see that by default, some of the fields are grayed out and can't be edited. So let's go ahead and click on this CNE info manual entry here, and we'll be able to edit those fields. There are 5 required elements on the summary page. Let's go ahead and start with the number of lab confirmed cases. Here we want to enter the number of cases that are classified as confirmed cases according to the Outbreak case definition, and ensure this number matches the number of confirmed cases linked to the Outbreak entry. Same kind of deal for the number of probable cases. Enter the number of cases that are classified as probable cases according to the Outbreak case definition. If there aren't any cases that fit this criteria, enter 0. And ensure that the number also matches the number of probable cases linked to the Outbreak entry. Now, a bit of a note about case classification here. For almost all outbreaks, it's expected that the Outbreak case classification will match the surveillance case classification for all cases in the outbreak. Excuse me. However, in rare circumstances, investigators may use an Outbreak case definition in which the Outbreak case classification varies from the surveillance case classification for one or more cases. And if you choose to do that, then you'd have to enter the Outbreak case definitions up here. If the number of confirmed or probable cases linked to the Outbreak entry does not match the number of cases for that classification indicated in the summary page, the page that we're in here, because of the specific Outbreak case definitions being used, indicate the Outbreak case definitions in the summary page, again, up here to please explain that variation. I know that's all a bit confusing, so let me say if there is no outbreak-specific case definition being utilized for this outbreak, which is what we generally expect, then the case definition fields are not required. You can leave them blank. Also, we have more guidance, again, in our COVID outbreak definitions and outbreak module guidance documents, which should be helpful in trying to understand the surveillance case classifications versus the outbreak case classification. So let's move on to the number of estimated primary ill. This is also a required element. And this is the estimated number of primary cases that are part of the outbreak. Outbreak module includes an internal check to ensure that this number equals the sum of the cases in the number of confirmed, probable, and suspect cases field. So just a sum of all these fields. Two more required elements is for hospitalized. This is the box under the label number of cases is the numerator, and which is the number of cases linked to the outbreak that were investigated and for which we know that they have been hospitalized. And the box under the label total number with info for hospitalized is the denominator here, which is the number of cases linked to the outbreak that were investigated, and again, for which we know if they were or were not hospitalized. The numerator must be less than or equal to the denominator. The denominator must be less than or equal to the number of estimated primary ill, and the denominator cannot be 0. So numerator, denominator for hospitalized, and pretty much the same rules applying for the numerator and denominator of cases who died in the outbreak. So those are the 5 fields for the summary page. Let's go ahead and click Save and move on to Summary 2. This page has either 3 or 4 required elements, depending on the type of setting that you chose. The first is this field here, setting exposure type. These are new fields to MEDSIS to capture exposure type for educational settings and also for public gathering settings. The educational setting field will only appear when the type of setting on the main page is one of the school, daycare, or university options. And the public gathering setting fields will only appear with a type of setting is selected as public gathering. Any other type of setting in these fields will not appear. So we selected middle school. For the education setting, we want to choose the option that best describes the primary exposure linking outbreak cases in students or staff. Options include athletics, classroom exposure, ops exposure, etc. Can refer to our outbreak module guidance to review the outbreak definitions in educational settings. And so let's say our Hawkins outbreak started with a classroom exposure. So go ahead and select that. Public gatherings has other options for this field as well. Going on to the next required element, could etiology be determined? Indicate for if COVID-19 was the confirmed etiology for this outbreak. So again, consult the outbreak module guidance to determine the number of confirmed cases required for an outbreak in this setting to be considered a novel coronavirus outbreak. If the cases linked to the outbreak meet that threshold, then choose could etiology be determined equals yes. So we're going to say yes for our Hawkins Middle School outbreak. Now, confirmed outbreaks of respiratory illness with an unknown etiology may be entered as NCV morbidity, even if novel coronavirus is not the confirmed etiology. If NCV is not the confirmed etiology, and this was not a confirmed outbreak of another respiratory illness or an unknown respiratory illness, then the outbreak status should be updated to ruled out. For the next required elements, was there any specific action to control the outbreak here under outbreak control section? pretty straightforward. Check all that apply. So yeah, I don't know. Let's face masks obtained, required, enforced. Yeah, check all that apply. We also, just to let you know, several options have been added to or modified in this section recently in the OBM enhancements to more fully capture outbreak control measures in COVID outbreak response. So select all that apply there, and then we can move on to the final required elements, other actions, and investigation methods. Again, check all that apply. Pretty straightforward. And let's go ahead and save the summary form. Next is the environment and contributing factors page. On this page, under the section of factors contributing to outbreak, check the box next to the type of transmission and select contributing factors. So for COVID, we're going to check, sorry, this is down here. So for COVID, we're going to check person to person, and you'll see these fields will be editable. And again, select all that apply. We also have changed nosocomial outbreaks to this label here, healthcare or congregate living settings outbreak. So of course you can check this for COVID-19 as well, and do all that you need. We're in the middle school, so we're not going to do that one. But yeah, let's indoor setting, and some additional fields have been added as well in the most recent outbreak module enhancement. So yeah, select all that apply and save. We have now covered all of the required elements for COVID-19 outbreak entries. So thank you for bearing with us so far. We're getting there. We're almost done. And of course, you can use any of the other fields and sections as preferred by your jurisdiction. These are really the minimum required elements for COVID-19 outbreaks to be closed. Now, segueing to closing an outbreak. As we mentioned before, once the required elements are complete and you have finished editing the outbreak entry, update the outbreak status here on the main page to closed. So let's go ahead and do that and save. This is considered submitted to ADHS now, at which point we will review the data for completeness, contact the investigator for any data cleaning concerns, and then update the outbreak status to final, which is the equivalent of state reviewed. And lastly, just looking at the clock here, so we're going to look briefly at accessing and using outbreak module data. So let's go to outbreak module generally. So let's go out of the outbreak entry for Hawkins Middle School and just go into the general outbreak module. To download extracts, let's go ahead and click OB extracts here. And the two most useful extracts for COVID outbreaks are these top two, outbreak summary extract and multi-outbreak case extract. And I'll let you play around with them at your leisure. Don't really have time to just kind of show them, but just briefly the use of them, of these two. The first one, the outbreak summary extract, this includes one row per outbreak, so it's outbreak level data. All of the COVID-19 required elements are included in this summary extract. So we'd recommend using this extract to review all of the outbreak entries in your jurisdiction. And for the multi-outbreak case extract, this produces one row per case for all the outbreak entries that fit within the search criteria, so case level data. This extract does not contain information found in the MEDSIS case records, but users can merge this extract with other MEDSIS extracts in order to perform analyses, and the short form information is in this one. So you don't actually need to really do any other search criteria. If you want COVID, then you would for morbidity. But you can search and just get all of the outbreaks under your jurisdiction. And if you have free time, it's kind of funny to read through the outbreak names that different people have chosen in the MEDSIS training environments, the fake outbreak names. So I digress. Yeah, so I think that's pretty much it. We can provide more information on the other extracts in just the call notes for time's sake right now. And again, our outbreak team can provide data outputs or line lists merging MEDSIS and OBM extracts, so let us know. Additionally, our COVID outbreak team is available to broadly support the local health jurisdictions in creating, completing, and closing outbreak entries, including identifying outbreaks that have met the resolution definition, identifying cases that should be linked to closed outbreaks but are not yet linked based on information in the address fields or DSO, identifying outbreak entries that are missing required elements, and completing some required fields using data found elsewhere in MEDSIS, such as number of cases and severity factors like hospitalization and deaths. We can provide data outputs, some, like I mentioned, in order to complete some fields. And although please note that we will not be able to complete certain required fields that require knowledge of the outbreak investigation, such as outbreak control and factors contributing to outbreak sections. So please contact us at outbreak@azdhs.gov if any additional support is needed. And now I'll go ahead and hand it over to Mary Leaf to moderate our Q&A session. Thank you.
Thanks, Guillermo. Are there any questions that anyone has for the outbreak team?
Hey, Marilee, this is Marette with Coconino. I found that one of our biggest challenges was kind of knowing when outbreaks start and end in certain facilities where it's semi-ongoing. Do you have any, tips for how to do that? Or really, are we just starting a new outbreak for every new single case that we get in those facilities? If that's
no, yeah, that's a good question. Yes, so the outbreak definitions have guidance on when an outbreak's resolved. So you can review that. And we also have been working on some assistance to provide counties that we can use the cases already linked in Outbreak module and see if the time frame between cases has met the resolution definition, and we can help you identify which ones are resolved. Of course, that relies on having all affiliated cases linked to the outbreak. But typically it's 2 incubation periods without any cases. So 28 days have passed since the last known exposure in that setting. Oh, okay. And I see a comment here from Jimmy in Maricopa that also the 28 days with no new cases. So, and again, we do have some support we can provide for that, where we can look to see if the cases, if there's a 28-day span with no cases.
Do any counties have tips for how to stay on top of these, knowing that we have however many investigators all finding out different information, and it's just hard to put all the information together and get it into Outbreak module. I don't know if anybody has any tips for how to do that.
Yeah, does anyone from any of the other counties want to speak up and see how you do that? Okay, Jimmy makes a comment from Maricopa that they utilize the notes field quite a bit. So there's a page called Notes, and typing information in there is a good way to share information from one investigator to another and have it all in one place instead of having to search through emails or files or that sort of thing. It's a lot, Marette, and we recognize that. Outbreak module has never housed this many outbreak entries ever. Okay, another comment from Brandon with Maricopa County. He says they close outbreaks after one incubation period, so 14 days, if they have performed 2 rounds of serial testing. So that's mostly used in long-term care facilities and assisted living facilities, and is consistent with CMS guidance. And then Jimmy says, when investigators uncovered a new outbreak, one of the earliest notes entries was a template that covered some of the essentials, like basic control measures, etc. Any other thoughts on that topic about ideas of how you manage your data in Outbreak module to share with Marette? Okay. All right, and then we have, okay, Selena says we use comments, and we also have investigators reporting to one person who's managing the Outbreak module. So. Okay, and then we have a comment from Benito. Benito, I think you're asking when do we consider, when is ADHS considered to have been notified? Am I understanding that question correctly? Okay, so that's actually not currently a required field in Outbreak module, the date that ADHS was notified, because we can figure out what date it was entered into Outbreak module and use that as a proxy. So you can consider ADHS notified when the outbreak entry is entered into Outbreak module. If you do have a conversation with the regional EPI or some other communication with ADHS, then you can use that date. And then there was a question earlier that came through the chat. The question was about, does it matter which user role you're in when you're searching for existing outbreaks in outbreak entries in Outbreak module? This would only apply to ADHS users. When we're using our ADHS EPI role, we can see all outbreak entries. They're only editable from within an EPI role for that, the jurisdiction, while it's open or investigation complete. And once it's closed, it can be edited from both an ADHS EPI role or the local health department EPI role. Okay, so there's a question from Benito. Can you repeat the information about severity, numerator versus denominator? Yeah, this is a confusing section that we often get questions about, Benito, so I'm glad you asked again. But basically for the severity factors of hospitalized and died, we want to know how many individuals were hospitalized and how many died. So that's your numerator, how many people were hospitalized, and you place that in the box under the label number of cases for both hospitalized and died. And then we also want to know, how many people you had information about hospitalization and died. I think for COVID, this is less important than other diseases because we have quite robust surveillance for hospitalization information and death information. So for most outbreaks, your denominator, the number of cases for which you have information about hospitalized and the number of cases for which you have information about died will be equal to the number of cases in that outbreak. But for other diseases where we don't have quite as robust surveillance for hospitalization information, that may not match because we may have hospitalization information for only a subset of cases. Oh, if you want to type a question into the chat, you sure can. Or if you want to ask a question, press *6 to unmute your phone. We still have about 5 minutes for questions. I'll just make a couple of comments while you're thinking of questions, but feel free to interrupt me. The number of required elements for COVID-19 is different than what we have for other diseases, in that there's fewer required elements than what we typically have for other outbreaks. So we understand that this is quite burdensome with many outbreak entries in Outbreak module, and we want to try to help as much as we can. So we pared it down to just the bare minimum required elements that we think will be really beneficial as we analyze and review outbreak data and better understand as time goes on the outbreaks that occurred during this COVID-19 pandemic. If there are any concerns or questions about any of these particular required elements, please reach out to us, because we have, for a lot of these fields, we can help quite a bit. For example, we can help tally up the number of confirmed cases and probable cases based on those cases that are linked to the outbreak. We can also help tally up the number of cases that are hospitalized or died based on cases that are linked to the outbreak, so that you don't have to hand count these. We can use other resources to help with that. We can also help with identifying cases that should be linked to an outbreak but just haven't yet, using DSO data or other areas in MEDSIS that indicate they might be linked to an outbreak. And we stand at the ready to help as needed with those sorts of activities as well. We, at your request, we could take more of a proactive role and just go ahead and link cases to outbreaks when we identify them. Or we could share those cases with you for your review, and then you link them to outbreaks as well. So again, hoping that this will help take some of this kind of data summary burden off your shoulders as we can. Any other questions for the Outbreak team or comments? Feel free to reach out to us if you're looking for, maybe brainstorming ways that we can help prioritize certain activities, because we know it's a lot, and there's a lot on county shoulders right now, so we can help with that as well. Also, we are anticipating additional enhancements to Outbreak module that hopefully will make it easier. Those aren't quite in the works, but we've got some things planned out that we hope can be added to MEDSIS and Outbreak module. As you're reviewing your outbreaks, you may identify some where a setting had a 28-day span without any cases and then had a second surge of cases. And if that's the case, then what we would recommend happen is that you open a second outbreak entry for that location and link the second wave cases to that outbreak entry. So if a long-term care facility had a wave, 28 days with no cases, and then a second wave, it would be 2 outbreak entries for that same location. And then Benito has a question: will the symptoms numerator and denominator be similar with the symptoms versus the total number of cases? So actually for COVID-19, we do not have any of the symptoms as required fields, which is different than what we have for other diseases. But yes, the symptoms is also there are two little boxes for each symptom. The first box, you put the numerator, so the number of cases that had that symptom, for example, fever. And then the second little box is where you enter the total number of cases for which you have information about whether or not they had fever. And so for some outbreaks, the denominator is equal to the total number of cases. But for other outbreaks, you don't have that information for all the cases, so the numerator might be smaller. Oh, excuse me, the denominator might be smaller. But again, those are not required elements. And if you're looking to prioritize your time, maybe focus on some of the others. Okay, we've hit 3:30, so I'm going to hand it back to you, Amy, but please know the Outbreak team stands at the ready. We're happy to meet with you by phone. We can join in on a regional EPI call. We can be accessible by email. Thank you.
Thank you, Marilee. Marilee, do you want to repeat the email again to everyone? Which email, if they have any question, which email do you use?
Sure. The email group that we use is outbreak@azdhs.gov, and that reaches everyone on the Outbreak team.
All right. Okay, everyone. So if we don't have any question, I think we could go ahead and close out this meeting. Like I mentioned in the beginning, once the recording is ready, we will post it on MEDSIS resources, as well as we'll post it on MEDSIS homepage for 2 weeks for people who might have missed this meeting to go through, and for those that need a refresher. You could also use the recorded video. And again, thank you everyone for joining us this afternoon.
Thank you for organizing.